Hi, my name is Amanda. I'm a nurse practitioner student from William Patterson University. I'm going to be doing a physical examination on you today. And we're going to start from the head all the way down to the cardiovascular assessment. Is that okay with you? Do I have your permission?
Yep.
And also to record it for class?
Yep.
Excellent. So we're going to start off with, I just washed my hands too. We're going to start off with what's your name?
My name is Julia.
Okay, Julia, what's your last name?
Guida.
Okay, and what's your date of birth?
12/31/1997.
Alright, excellent. So we're going to start off with the general appearance. So you're sitting up properly, your skin color looks normal for your skin tone, you are alert, you're following commands, answering questions appropriately, and maintaining eye contact. Now we're going to start off with inspecting the head. So we're going to look, your head looks symmetric to me. I'm going to start palpating your scalp to your neck. Okay, do you have any abnormalities that you've noticed, any bumps that have been bothering you? No? Okay, your scalp feels no bumps at all, which is great. Okay, next we're going to be assessing your cranial nerves 5 and 7. So can you give me a smile? Great. Can you give me a frown? Excellent. Can you raise your eyebrows for me? And close your eyes really tight as you have soap in them. Excellent. So it's symmetric and equal. Now I'm going to touch you on both sides. You're going to tell me if it feels the same or different, okay? Same or different?
Same.
Same or different?
Same.
Excellent. Next I'm going to palpate your temporal muscle. Okay, I'm going to go right up to here to your temporal muscle. I want you to clench your teeth for me. Right, and they're palpable. Now we're going to your master muscle right over here. And I want you to open and close your mouth for me. Excellent. Again, it's palpable. Okay. Next, what we're going to do is we're going to assess your eyes. Okay. So what I need you to do is to look at me real quick. Thank you. So I'm just looking and inspecting. So your sclera is white. I want you to look from side to side so I can look at your conjunctiva. So your conjunctiva is pink. It looks moist to me. I'm going to touch your lacrimal apparatus, which is your tear duct here. I'm going to just touch it to make sure that there's no extra discharge coming out, which there's not, which is great. Again, there's no swelling noted, so we're going to continue on with the eye exam, okay? So first we're going to do is the Respiratory test. So we're going to take my pen light. We're going to look into your pupils, so they're reflective to light. They're 3 rounds, and they're brisk to light. Next, we're going to make sure that they're consensual to the light. So I'm going to look into the right eye, the left eye, make sure the right eye constricts, which it does. Same thing going to your right eye here, and make sure your left constricts at the same time, which it does, so that's called consensual. Okay. Next we're going to do the cover test, okay? So I want you to cover one eye for me, and I want you to look at me, okay? And I want you to uncover it. So we're making sure that your eye doesn't correct itself when you uncover your eye, which is great. It's normal. Now you do the other eye. And you're going to uncover it again. Excellent. So again, it doesn't correct itself. Now we're going to touch cranial nerve number 3, which is your upper lip. So I want you to follow my finger with just your eyes. You're going to look this way, look this way. I want you to look up and look down. And we're going to test abduction. So I want you to follow to the center of your nose. Excellent. Okay. Next, what we're going to do, I'm going to test for your peripheral vision. So I want you to cover one eye for me. And I want you to tell me when you see my fingers wiggling, okay? But look at my nose.
Wiggling.
Okay?
Wiggling.
Excellent.
Wiggling.
Great, now we're going to switch. Go ahead.
Wiggling. Wiggling.
Wiggling. Perfect. Alright, now we're going to test your distance vision. So we're going to use the Snellen chart. I want you to read the lowest line you can read to me, okay? Alrighty. We're going to go from far and read the lowest line.
FDELTCEO.
You did really good. Like you see the lowest line. Excellent. So again, she's a 20 out of 10, so she sees very well. That's actually, yeah. How about over here, starting from this line. Can you read this line?
DEFEOTEC.
Okay, and then when you read up close, can you read this line? That's your near side.
FDPLTCEO.
Excellent. Alrighty. So next, what we're going to do is I'm going to assess your fundus and your retina. Okay. So I'm going to use my my ophthalmoscope. Alright. I want you to find a fixed point on the wall over there. I'm going to look into your eye. Okay. Alright. So she's got the red reflex present, which is excellent. Her retina has no abnormality seen, and her disc is sharp, which is great. Now in the other eye, Again, she has the red reflex present, her disc is sharp, and then there's no abnormality seen in her retina. Okay. So next thing that we're going to move on to is we're going to assess your ears, okay? So I'm just going to inspect it. They're symmetric. There's no any abnormalities there. I forgot for your eyes, I didn't say, so there's no edema or swelling on your eyes. Your eyelids are fine there, and your lash line is nice, very nice, natural lashes in my opinion. All right, so moving back to the ears again, like I said, they inspected them. They are intact. I'm going to start pulling your pinna to make sure there's no pain. And I'm going to push on your tragus. Is there any pain? No. Excellent. I'm going to do the same thing to this ear. Any pain?
No.
Any pain?
No.
Excellent. So now I'm going to take my otoscope. I'm going to look into those ears of yours. Okay. I'm going to pull the pinna out and insert my scope. Again, your ear canal is pink. There's no discharge or abnormalities noted. Your tympanic membrane is a pearly gray color, which is great. And the cone of light is at 7 p.m. or 7 o'clock, sorry. Now over here, looking at your right ear, again, your ear canal is pink, there's no discharge noted. Your tympanic membrane is also a pearly gray color, and then your cone of light is at 4 p.m., 4 o'clock. It's nighttime, that's what I'm thinking, it's night. Okay, next we're going to assess for your hearing tests right now. So I'm going to hit these, and the first test is a Weber test. I'm going to put it on the top of your head. You're going to tell me if it sounds symmetric on both sides.
Symmetric.
Excellent. Now the next test is the Ryan test. I'm going to hit this and put it behind your ear, and you're going to tell me when you don't hear it anymore, then I'm going to put the bell to your ear, and then that's when you'll tell me when you don't hear it again. Okay?
Don't hear it. Don't hear it.
Next one.
Don't hear it. Don't hear it.
So it's actually symmetric both sides, which is great. And next is the whisper test. I want you to cover one ear for me. I'm going to whisper a word.
Water.
Excellent.
Soda.
Perfect. So you said both words correctly, so your hearing is great. Okay. So next, now what we're going to do is we're going to go to the nose. Okay. So I'm going to inspect it again. The skin's intact. There's no abnormalities. I'm going to palpate the cartilage, the bridge of the nose. No pain or tenderness. I'm going to palpate the soft tissue here. No pain or tenderness. Again, I'm going to palpate the maxillary sinuses. Any pain or tenderness?
No.
All right. And then I'm going to do your frontal sinuses. Any pain or tenderness?
No.
Excellent. So now I'm going to take my otoscope. I'm just going to inspect your nose and your bilateral nares. I'm going to go up. Okay. So bilateral nair, so the one nair, so it's pink, it's intact, there's no discharge or noted, and it's patent, there's no abnormalities. Again here, I'm going to inspect, so it's pink, it's patent, there's no abnormalities noted, and there's no discharge, which is great. Alrighty, next I'm going to assess your cranial nerve 1, which is your olfactory nerve, it's your sense of smell, so what am I holding?
Coffee beans.
All right, the best smell here. All right, excellent. So now we're going to go on to your mouth. Okay, so again, we're starting off with inspection. So her mouth is symmetric. There's no abnormalities. Skin looks intact to me as well. So I want you just to open up your mouth for me. Go ah. All right, so I'm just inspecting the mucosa down here. I'm inspecting the soft palate, the hard palate. It looks pink, intact. I'm also inspecting her dental, and there's no abnormalities seen. And now I'm going to go grab the tongue depressor real quick. Alrighty, so we're going to test your gag. I'm also going to assess your tonsils, okay? So I'm going to assess the tonsils first. So they're equal symmetric. They're painting down to the mouth. There's no cobblestone noted. Now we're going to test the gag. Okay, sorry. So the gag is obviously present. So that's your cranial nerve 9 and 10. Then last one we're going to check is cranial nerve 12. So I want you to stick your tongue out and move it from side to side. Excellent. And now since I tortured you, I'm going to give you a treat. We're going to test cranial nerve 9 and 9 and 7. And that's going to be a treat. So either it's going to be sour or sweet. So tell me.
Sweet.
Alright, good. So it's your peppermint patty, your favorite. Excellent. Alrighty, so now we're going to go on to, move on to your neck, okay? Okay, so we're just going to inspect it again. So we're making sure that there's no abnormalities, it's symmetric, which it is, her skin's intact. And then now we're going to also palpate. So we're going to palpate your carotid arteries right here. Excellent. And palpate this side. So bilaterally, there's no thrill noted, and they're +2, which is great. Now I'm going to go behind you. I want you to swallow for me when I tell you to. We're going to inspect the trachea and the thyroid. So we want the thyroid to go with the trachea as they swallow. So take a swallow for me. Again. Excellent. So you feel the trachea and the thyroid moving up, which is great. Now we're going to auscultate both the thyroid and the trachea. Okay? So hold your breath for me so I can auscultate it. Excellent. Now this side. Excellent. No bruit heard. And then now we're going to do the thyroid. Hold your breath. Great. No bruit heard. Okay, now we're going to assess your lymph nodes. So we're going to just do the head and the neck first. And our goal for lymph nodes, we wanted to make sure that they're not palpable, that way they're not sick, which you're great on your head and neck. Then we're going to do your superior clavicle. Perfect. They're not palpable. And then your axillary ones. Okay. Not palpable. Perfect. Not palpable. Okay. So now what we're going to do is we're going to go down to the chest. Okay. So right now she's in the scrub top, so we're just going to do the best we can. So we're just going to inspect her skin. Her skin looks great. It looks intact. She looks like she's symmetric, which is perfect. Now we're going to look at the back as well. We look posteriorly and anteriorly. Okay, I'm going to lift up her shirt again. It looks clean, dry, intact. There's no abnormalities. And again, she looks symmetric. Okay, while I'm in the back, we're going to assess for your tactile firmitis. So I'm going to just put my hands on your back. I want you to take a deep breath. Excellent. And one more time. Perfect. So it's symmetric. There's no vibrations noted as well either. So we're just going to look on both sides too. So put your arms together and take nice deep breaths. So we're looking at the thoracic cavity to make sure that it's symmetric, that it's equal, which it is. Excellent. So you can rest your arms now. Now we're going to palpate to make sure all the lobes are resonating. Okay. So I'm just going to palpate in the areas. So now I'm going to go, again, we do this posteriorly and anteriorly as well too. And while I'm here, I'm going to start auscultating in the back since I'm already here. So we're going to listen to all the lobes of the lungs. We'll start back here. So take a nice deep breath for me. Excellent. I'm just going to pair back, sorry. Excellent. So bilateral lungs, anterior, posteriorly, and all lobes. There's no adventitious breath sounds. Your lung sounds clear, which is perfect. So you can put your gown back on you so you're more comfortable. And we're going to have you lay down because we're going to do the cardiac exam. Okay. A little bit more. Sorry. Here, okay. So we're going to start off, we're just assessing her neck. We want to make sure that there's no JVD noted, which there's not. Her neck looks great, symmetric again. And then now we're going to start auscultating her heart sounds. Okay? So we're going to start in the aortic first. It's the second intercostal on the right-hand side. Go to the pulmonic. Down to Erb's point. To tricuspid. Lastly, to the mitral, this is also apical. And again, noted she has S1 and S2 present, and then there's no murmurs or other heart cardiac sounds noted. Okay, so next we're going to inspect. We're going to palpate some of your arteries. So the first one that we're going to do is your renal artery. Is your aortic artery. So I've already auscultated it here when I did that. So again, it was no thrill noted. There was no bruit felt. I'm going to actually feel it first. I didn't get to feel it. Sorry. There's no thrill felt and there's no bruit heard, which is great. Okay. Next, I'm just going to lift up your, to your stomach. So we're going to do the renal arteries first. So we're going to expect, okay, then we're going to palpate, okay. Perfect, no thrill on this side, no thrill on that side. We're going to auscultate for a bruit. No bruit, but +2, which is great. Now next we're going to go to iliac. No thrill noted on the right. No thrill noted on the left. We're going to auscultate it now. It's +2 bilaterally. And there's no bruit. Now we're going to go down to your fem. Okay. Sorry. I'm trying to cover you so we're not really exposing you. Sorry when we have an IV pole be our cameraman. Okay, so we're inspecting. So usually her pants will be down, but right now it's just for modesty. We're gonna leave it on. So we're just gonna palpate, inspect. She's no thrill felt and +2 again. No thrill felt +2. We're gonna auscultate now. Perfect. No bruit heard, which is excellent. Okay, now we're going to check the upper extremity pulses. So we're going to check the radial pulse here. Perfect, +2. You have a nice, strong heartbeat. No thrill felt. And then here on your brachial, +2. Very strong pulse, excellent. Now on your left side, +2 pulse felt. No thrill noted. Okay, +2. On your brachial, on your left, no thrill noted, which is great. I'm just going to move my camera guy down with me so we can assess your lower extremity pulses. Okay, sorry, we took the first step. Okay, so normally again, her pants would be off, so it's easier to assess. You want to inspect the skin. You want to make sure there's no edema noted. She's got no edema. She's got very nice skin. So we're going to assess, we'll inspect, and we'll palpate her palpatile pulse. So her palpatile pulse, we're going to feel that. Okay, there's no thrill, and it's a +2, which is great. Again, with this one, we're going to inspect and palpate. Again, +2, no thrill noted. And then we're going to go down to your tibial pulse. So that's +2, no thrill noted. Excellent. Again, we're palpating, we're inspecting, a +2 on her other tibial pulse. And again, she's got a nice +2, she's got very strong pulses. Last one, you're going to do your dorsal pedius, sorry. So they're +2 both, they're palpable. Okay, there's no thrill noted. She's very clean assessment. Do you have any questions about anything I just did with you?
No.
Okay. Well, thank you so much. I really appreciate you doing this with me, and you're a wonderful patient.
Thank you.
Yeah.